Hi, my name is Dr. Gary Hitzig. I'm a physician who practices normally in New York, but I'm here at the Poseidon-Klinikken and really happy and very excited to do the first clinical trials of approved extracellular matrix outside of the United States. Many people ask me over the course of time, because I've been working in this field since 2008, actually before that, but before the FDA, or Federal Food and Drug Administration in America, approved it for human use. Many people ask me, so what have I seen? What kind of results? Well, over the course of 6 years, we've used it in over 1,000 patients, and we've had a tremendous result. I compare this very similar to a flu vaccine. You take a flu vaccine, it may not stop you from getting the flu, but you certainly have a heck of a better chance of not getting the flu from it, and if you get it, you'll get a milder case. And this is the same thing. This is a vaccination where there's no 100% in anything except death and taxes, but this has an overwhelming, in over 1,000 cases, has an overwhelming result of stopping hair loss and varying degrees of regrowth of hair depending on the strength of the hairs that are remaining there. So we've been very pleased with it. We're bringing back the fort that crumbled, that protected the hair follicles from the dihydrotestosterone and allowed the enemy to get in there, is now being rebuilt. And that's what these injections do. So it's a vaccination to stop hair loss, and it's a vaccination to take the hairs that are at risk but still have enough energy to recover and let them recover. The procedure of the vaccination is not surgery. The procedure is, it's easier to save the hair than to grow it back. So the sooner we get people at risk and the sooner we vaccinate them, the better the result's going to be. So essentially, we want to get those people earlier on. One of the most important things to understand is that just because a person may read a paper and think that they can do this by reading a paper doesn't mean that they can do it. A person must be well trained. First of all, he must understand the properties of the extracellular matrix. If he doesn't, he's not going to know how to use it. This is something that takes time and experience and proper training, and you have to know how to use the material, and you have to know to adapt to different people with different hair qualities, different scalp textures, different patterns of hair loss, making sure you're not missing disease processes that are going on there. A good surgeon takes a difficult procedure, or a good doctor takes a difficult procedure and makes it look easy. That doesn't mean it is easy. It just means that the person knows what he's doing.